I'm Dr. Megan, the Prednisone pharmacist, and I'm here live on YouTube and Facebook, here to help answer questions that you might have about prednisone and other steroids like methylprednisolone or hydrocortisone. And I am excited to be able to answer your questions. So I've had a few questions come in, and so I'm going to just start going through those questions. And if you have more questions, please drop them in the chat so I can answer them and you can get the help you need, because being on prednisone is tough and we all need all the help we can get. All right, so here are some questions. Pull up my list. Okay. So it says, please make a video on prednisolone effects on the kidney. My mother is taking 400 milligrams per week in the last 6 months, along with rituximab for vasculitis. Now I see her creatinine levels are increasing. Guide me on how to take care of her kidney. So, what does prednisone do to the kidney? That's a really important question because a lot of people take prednisone for kidney problems. Things like glomerulonephritis, lupus nephritis, kidney transplants. A lot of people are taking prednisone for kidney issues. So, what is prednisone doing to the kidney? Uh, and I just want to say, not much. It's not, prednisone is usually not harming the kidney. Cross our fingers. Prednisone harms like so many other things, but damage to the kidney is not usually one of them. So, if your mother is having creatinine levels increasing, that means that the kidney is not working very well and the effect of that kidney is going down. So creatinine is bad to be going up. We want it to be at 1 or below. And if it's going above, that's bad. That means there's damage showing up in the kidney area. So guide me how to take care of her kidney. So I don't think that prednisone is the source of the problem when it comes to the kidney. Often, like I said, prednisone can help with kidney issues. And then some things I do know that prednisone does to the kidney includes it increases the amount of sodium the kidney holds on to and decreases the amount of potassium the kidney holds on to. And that changes the water balance so that there's more water being held. When the kidney holds on to sodium, that means it's also holding on to water. And so that can lead to swelling, swelling in the feet, knees, face, like in the moon face, just general weight gain, water weight gain. And so that's a thing that the kidneys do change when it comes to what prednisone is doing to them. But that doesn't usually damage the kidneys per se. It damages your heart's ability to pump, all of that extra fluid. It's hard on the heart to pump that much extra fluid. So it's not necessarily the kidneys that are having consequences. It's really the kidneys have changed what they're doing, and that's hard on other things. And so that can lead to heart side effects like increased risk for arrhythmias, high blood pressure, and on and on. Lots of potential heart complications. But the good news is there's not a lot of potential kidney complications. So for people who have to take prednisone, have no other choice for their kidney diseases, it's usually a pretty safe option. Aside from the fact that it comes with a lot of side effects. Okay, let's see what other questions do we have? So, can you talk about allergies or intolerance to prednisone? Okay, so I'm not really aware of allergies to prednisone itself. Um, that's just not a thing I personally have seen. Nobody has told me, hey, I'm allergic to prednisone. And while it's definitely a possible real thing that can happen, I have personally not seen that as a reaction. Um, It could be that prednisone does cause allergic reactions. I'm just not personally aware of any of those. And that's really weird because prednisone is prescribed to treat allergic reactions. So somebody's having a really bad rash because they're allergic to something that they touched. They're having poison ivy, it's a allergic reaction. Or, other allergic reactions like allergies, sinus issues. Prednisone can be prescribed to help make those things go away. So it's strange that a person could have an allergic reaction to prednisone because it's mimicking the body's cortisol hormone that is often used to deal with allergies. So while it's possible, it's not something that is common. It's not something that I ever have seen. And then you also talked about intolerance to prednisone. Now that I have seen. Intolerance to prednisone. I personally feel pretty intolerant to prednisone because it's such a harmful medication. Back to the fact that prednisone can cause so many side effects, right? Prednisone can cause more side effects than potentially any other drug. Um, at least 150 side effects have been documented, and these are miserable. I've mentioned heart disease, osteoporosis, like permanent damage to your bones, to your heart, to your eyes, plus all of the mood changes like anxiety, psychosis, insomnia, and then the ones that people can actually see, like moon face, big round face like the moon, belly weight gain, loss of muscle mass in the arms and legs. Those are just the outward manifestation, or as in wicked manifestorium of the what's happening on the inside, the outward manifestorium of an inward change, right? So there are definitely people who are intolerant to prednisone because of how horrible the side effects are. That essentially what we mean by intolerance is that the benefits of prednisone might be this much, but the side effects are this much, making it so that the benefits don't outweigh the risks. Like there's so much here on the weight side that the benefits just can't compensate. Like there's just not enough goodness that prednisone is doing, and there's so much badness that we got to find that balance. And so if you are about to die or about to go blind with multiple sclerosis or something like that, you're willing to put up with a lot of side effects, right? Like the benefit is humongous. And so even if the side effects are humongous, at least they're kind of balancing each other out. But if you're taking prednisone for, say, the flu, the benefits are minuscule, actually negative. You're more likely to die if you take prednisone for the flu. And the risks are huge. Like you're more likely to die. So like it's not going to help. It's not going to help you have a shortened flu time. It's not going to help you have a less risk of being hospitalized, and it is going to increase your risk for death. So like the benefits and risks are completely out of whack. We've got to find conditions where the benefits outweigh the risks. And there are many ways that could happen. Okay, it looks like the chat. We have some chat questions. Okay, Jonathan says, I have psoriasis since 2007. Can prednisone help me? Okay, yes. Prednisone can help psoriasis. The thing about psoriasis, though, is like, what is psoriasis? First of all, psoriasis is like a plaque, a skin condition where there's like a thickness, usually on the elbows, knees. It can be other places, but those are the most two common places. And this like thickness grows, and it's a change in the way the skin is working, and it can be painful, it can crack and bleed, it can potentially be itchy, and it's and it doesn't look nice. Like you don't want to be wearing a swimsuit and showing off that. Like it's horrible. And so psoriasis can also lead to joint damage. So like if you have a plaque here, you might get pain here or even in other joints. That's called psoriatic arthritis. And if that is happening, Prednisone can definitely help with the arthritis. And it can potentially help with the plaques. But the hard thing about the plaques is they're so thick, there's so much happening that prednisone is often inadequate. And so they use creams and ointments and things instead. So like a topical clobetasol ointment applied there or other medications in a cream usually work better than a pill because it's just so far from what the pill can do. Generally the pill isn't the best method. So we want to minimize the damage by getting to the site of action. So like if you have a rash, you want to apply a cream. If you have trouble breathing, you want to use an inhaler. If you have an eye issue, you want to use an eye drop, right? We want the drug to go right to where the action needs to happen. And a pill is often not the best strategy for psoriasis. Usually a cream directly onto the site of the problem is the best strategy. But there are so many other medications that can help with psoriasis that have a lot less side effects. So if a person has psoriasis, um, prednisone may help, but it also can cause so many side effects that it's just not worth it for a lot of people with psoriasis. Whereas there's a lot of other medications, injectables, and other things that can really help. Um, they just tend to take a long time to really kick in. And so it's really frustrating because you're like, I've been on this $10,000 a month injectable medication for 3 months and I can't hardly see anything changing. And like maybe it was like 6 inches of a wound lesion before, and now it's 5 inches, but it's hard to see those slow changes be worth it. And so I get it. Like, wouldn't prednisone be better? It's really a good question for your dermatologist or your rheumatologist or whatever doctor is treating you. But yes, psoriasis and prednisone have had a definite history. But I would bring it up with your doctor. Okay, we have another question. I am diabetic and had a kidney transplant in September 2024, and my blood sugar is out of control. What should I do? Okay, that is a super good question because both the fact that you've had a kidney transplant and prednisone itself can lead to glucose dysregulation. They've done studies and shows that people who've had kidney transplants have a higher risk for they call it glucose dysregulation, changes to the way the body is using glucose. And so that is definitely a thing that you're at more risk for just because you've had a kidney transplant. Is it because of the transplant itself or because of all the medications you have to use to keep the transplant in your body? And a lot of the time, I would assume it's the medications. Like in pharmacy school, they taught us just assume it's the medication. Like, it's probably not some random weird new disease. It's probably just a side effect of the medication. And, like the famous quote, like, if it gallops, don't think a zebra, think a horse. It's more likely to be a horse. So it's most likely the medications. And one of those medications, it sounds like you're taking, is prednisone. And so if your blood sugar is out of control and you have kidney issues, you have a transplant, you have to take all these medications or you will lose your transplant. The option is not to stop taking the medications, right? Like that is not, we do not go there. We do not mess with those medications. But it's really tricky with transplants because a lot of things interact with kidney transplants medications, especially the number one, most likely that I'm aware of as far as kidney transplant medications that cause interactions is tacrolimus, which has lots of other names, but we call it TAC in pharmacy school, TAC, tacrolimus. You have to monitor the drug levels in the blood to make sure it's safe. And so we want to do whatever we can to avoid causing drug interactions that will make you lose your kidney. So that was what I wanted to cover first is we've got to prevent uh, any complications to your kidney transplant itself before I talk about other options. So, if you are diabetic and your blood sugar is out of control, generally what we do is adjust your insulin doses, right? So that means you need to be talking to your transplant doctors, your endocrinologist, whoever's prescribing the insulin to get the right amount of insulin. Because that's if blood sugar is out of control, it's because there's not the appropriate insulin involved. Other things that are really important to do is eating a healthy diet that is low in processed foods. Um, Eating whole foods, the Mediterranean style diet, those are really good strategies to help keep stable blood sugars. Finally, there are some herbal remedies and vitamins and things that can help, but a lot of them are not safe for somebody with a tacrolimus on board. So, one thing that prednisone is doing that you can potentially talk to your kidney transplant doctors about using is called chromium. So, our bodies have chromium. It's a metal mineral in our bodies. And it's usually in very trace amounts, like very small amounts. We usually have a little tiny bit of chromium. It's not like calcium where we have a ton of calcium. Like we just have a tiny bit of chromium. And it's usually kept in this nice balance and we don't usually waste it and we don't usually need to eat a lot of it because we only need a little bit. But when you take prednisone, it's making you excrete chromium. Like your kidneys, your new little kidney that you've got with that transplant is getting rid of chromium. Like it is making you pee out chromium. And it's not just people with kidney transplants, it's everyone on prednisone is depleting their chromium because of the prednisone. Like the prednisone is telling the kidneys, waste the chromium. And that's really bad because we need chromium in a complex with insulin to have proper blood sugar regulation. And we don't have enough chromium, that leads to blood sugar issues like diabetes and blood sugars getting out of control. So we want to make sure there's enough chromium so the insulin can do its job properly so your diabetes is under control. So talk to your kidney transplant doctor about, hey, is it safe for me to take chromium picolinate? Now that's the one that has the most evidence for benefit. They did a study in Israel in 1999 showing that chromium picolinate itself at a dose of 200 micrograms 3 times a day would reverse diabetes caused by prednisone. Like that is huge. And I even though I've read the studies and it proves reversal of diabetes, I feel like, can I even say that? Like, is that even legal to say that something reversed diabetes? And like, I can't say that on my product listing. Like, I sell a product, Nutranize Zone, that has chromium picolinate in it for this purpose. And I can't say that when I'm trying to sell it. But here, when you're asking a very specific question, I can say that because that's what the science shows. Like it was a peer-reviewed study in Israel. They gave people chromium picolinate and it reversed diabetes. Amazing, right? So at the very least, talk to your doctor about it. I do not recommend this product for people with kidney transplants because it has ingredients in it that cause a drug interaction that may lead to decreased tacrolimus levels. I don't want to do anything to your kidneys. So do not take my product if you have a kidney transplant. But the one ingredient in there is chromium picolinate that might be helpful, but you've got to talk to your transplant doctor and get their approval first. Okay. Okay. And more questions. Can I take Nutranize Zone for this? No, Muhammad, you cannot take Nutranize Zone. Please don't. I don't want you to lose your kidney. Okay. Kevin says, hi, thanks for taking the time to teach us. What questions do you have, Kevin? What questions do you have, Jonathan? I'd love to hear more questions you might have. Let's see. I'll pull up some that people asked in advance. Okay. Okay. Is melatonin can cause exacerbation in myasthenia gravis? Can you please make a video for this? Thank you. Okay, so myasthenia gravis is a disease where there's a problem where the junction between two nerves, the signals aren't being sent properly, and there's an issue, and it can lead to really harmful things like eyelid drooping, like the muscles in the eyelid aren't working properly, and so people can't hold their eyes open. It can close off people's throats, make their lungs not work. It's really scary. Like it's a really terrifying disease to like not be able to swallow food and things like that. So myasthenia gravis is another disease I don't want to mess with. Like I don't want to do anything that can harm it. And so there are some things that people with myasthenia gravis absolutely need to know. One of them has to do with injections of magnesium. So if magnesium is injected into a body that has myasthenia gravis, it can lead to a flare and it can be very dangerous and people can stop breathing. So we never ever inject my magnesium. Then this person's asking about melatonin. And I have not seen any evidence showing that melatonin leads to an exacerbation of myasthenia gravis. It might exist. I just personally haven't seen it. So I don't feel comfortable fully answering this question right at this moment. But as far as I'm aware, that's not one of the things that causes a flare of myasthenia gravis. Other medications may, including injectable magnesium, but I'm not aware of melatonin leading to a flare. The reason a person might want to know, could melatonin do that, is because there's evidence that even just one dose of dexamethasone, which is prednisone's sister drug, just one dose of that can lead to a complete deregulation of the body's sleep-wake cycle and ability to make melatonin. One dose throws off your ability to sleep properly at night. And so it would make sense that you'd want to know, is melatonin safe in myasthenia gravis? And can it cause an exacerbation? So, you know what? Since I don't have another question right now, I'm just going to go on PubMed and see if myasthenia gravis melatonin, if that's a thing. Let's just look it up. Oh, here we go. There's a thing. That was easy. All right. So there's a case report in the British Medical Neurology Journal that says myasthenia gravis exacerbation after melatonin administration, case series from a tertiary referral center. And they are saying melatonin may trigger exacerbations of myasthenia gravis, probably due to an upregulation of the adaptive immune system and an interaction with the corticosteroids and other immunosuppressant medications. We consider that melatonin should be administered with caution in these patients. So they're not saying like, no, never use melatonin. They're saying with caution. So if your myasthenia gravis is really, really like sensitive and really close to an exacerbation, like you're having other symptoms, maybe hold off on melatonin. But if you've kind of got your myasthenia gravis under control and you're just using prednisone to keep it under control, then you can talk to your doctor about it. I think that's the safest way to proceed, because we do not want to mess with myasthenia gravis. That is a life-threatening condition. And so melatonin supplements, they had 3 patients from 2014 to 2019 who presented with worsening within days of starting melatonin. So don't mess with that one. All right. So that answers melatonin and myasthenia gravis. Okay. All right. Here's a question. What if I'm only taking prednisone or Medrol or whatever steroid for 6 days? And they were asking this in response to my video called 7 Things to Avoid While Taking Prednisone. And they're like, what if I'm only doing it for 6 days? Can I just not avoid these things? And that's a really, tricky question. Some of the things I recommend avoiding include alcohol, and others that you shouldn't use them for those 6 days. And I've personally heard from someone who like binge drank alcohol this weekend after they stopped taking their short-term steroids, and it put them into a spiral of misery. And so I still would avoid alcohol during those 6 days. I still would eat a healthy diet during those 6 days. I would still avoid caffeine and other things. Like doing whatever you can to have prednisone have the best benefit for you and avoiding side effects. It's like it's short term. It's only 6 days. Like give up the alcohol, give up the caffeine, give up sugary foods for 6 days. I think, it's worth it for 6 days to make that drug do its best job, to let it have the most chance for helping you. Like if you're going to take this poisonous drug, like The dose makes the poison, right? If you're going to take this poison into your body for a purpose, why not give it the best chance you possibly can? So, I mean, why not? Is my question. What if I'm only doing it for 6 days? Well, yeah, like it's only 6 days. What's the worst that can happen? Oh, you wanna know the worst that can happen in 6 days of treatment? Fractures. You have a, like, 2 times greater risk for fractures, breaking your wrist or your spine or whatever with only less than 30 days of treatment. What about pneumonia? You have a greater risk for pneumonia. You have a greater risk for sepsis. That's a full-bodied infection that usually leads to death. And, like, the multi-system organ failure, multi-organ system failure that can happen. Those 3 things are more likely with even just short-term prednisone. So, if it's only 6 days, do whatever you can to support your body. Give it the good food and fuel that it needs. Avoid the things that it doesn't need so you can do the best you possibly can. Okay, so that was that question. Um, Okay, I got a question on Instagram. It said, "Hi, I've been enjoying your YouTube videos and I have a question. I'm currently on prednisone since February, and I think it's given me a stomach ulcer. I take it with food and just finished 2 weeks of Pepsid. I was curious, can prednisone be taken with baking soda instead of Pepsid? Thanks so much." So the ulcer is the problem here, and Pepsid is a way to deal with the symptoms of an ulcer. Pepsid doesn't usually heal an ulcer per se, and neither does baking soda. Um, it's kind of more of a symptom control. It just makes it so it doesn't bother you as much. And so, yeah, Pepsid is famotidine is the generic name for it, and it will make it so you don't have so much acid reflux. At least you don't feel them. It'll make it so you like Pepsid can help really just with the symptoms. And it doesn't really necessarily cure an ulcer. It may like help make it not so horrible for you, but it doesn't usually cure it. Um, and then a baking soda has been shown in combination with different kind of medication to help improve healing. So I'm assuming that's why you're taking it. The medications that are most effective for ulcers would be proton pump inhibitors like um, pantoprazole, which is Protonix, or Nexium, the purple pill, or omeprazole, all anything that ends in prazole. And you can get them at over the counter at the pharmacy now. When I was first being trained as a pharmacist, they were all prescription and they were the popular Ps, very expensive brand name drugs. And now you can get them over the counter and they are much more effective than Pepsid or baking soda. But they did a combination one, dexlansoprazole with baking soda. And then they charged like $500 a month just to add a few teaspoons of baking soda to the prescription drug. And it's like, that is so ridiculous to charge 100 times more for a medication because you added some baking soda that you can buy in the grocery store for like $2 for a whole box. I mean, just guys, think about how ridiculous that is. Oh, the world we live in. The ability for drug manufacturers to be able to add baking soda to a prescription medication to like lengthen their patent is just mind blowing. So frustrating to me. Anyway, so yes, what I'm trying to say is Pepsid or baking soda or pantoprazole or any other prazole can be taken with prednisone. That should be fine. The short answer is yes. Go ahead and do that. That's a good strategy. And if you're the kind of person who is taking prednisone and you have a history of getting ulcers, you should just take pantoprazole or Nexium or whatever along with prednisone. Like that should just be what you take. You take the prednisone and the Nexium all at once. Like just do it. Don't let the prednisone lead to an increased risk for ulcers for you. And then the other person who should definitely be on the lookout for ulcers is someone who's taking prednisone and ibuprofen or naproxen or Celebrex or any other NSAID, because those can increase the risk for building up an ulcer. That's because the prednisone is a steroid and the other drugs, ibuprofen as the example, are NSAIDs, which are non-steroidal anti-inflammatory drugs. So prednisone is an anti-inflammatory drug, and these are not prednisone anti-inflammatory drugs. And they're working kind of overlapping, and it can just really affect your gut and lead to a hole, an ulcer in your gut. So if you have to take prednisone and ibuprofen, then you also have to take Nexium or pantoprazole or whatever. Like you have to do that, or you're going to increase your risk dramatically for ulcers. Okay, so I got another question from John. He says, I have lupus and take 15 to 20 milligrams a day. Do you think that is a high dose? Okay, so for lupus, I don't think that is a high dose. So prednisone 15 milligrams to prednisone 20 milligrams for lupus is kind of a normal dose. If you were talking about rheumatoid arthritis, I would say that is a very high dose, because for people with rheumatoid arthritis, the joint pain issues that they have, um, it's normally between 5 and 10. But for lupus, you have a lot of other things going on, not just joints. You have your eyes and your kidneys and rashes and so many ways lupus can affect you, that 15 to 20 milligrams is, I personally don't consider that to be a high dose. And the term high dose is really confusing in the scientific literature. Every scientist defines it their own way. Some people define it as over 10 milligrams. Some people define it as over 15, some over 20, some over 40, some over 60. It's really just whatever that scientist feels like calling it. So I personally think 15 to 20 milligrams a day is okay. That's for every single person on prednisone, you want to find the lowest effective dose that keeps you without your symptoms of your disease. So whatever you can do to get it to that lowest effective dose. And for John, if it's 17.5 milligrams or if it's 14.5 milligrams, whatever it is, getting to as low as you can do without the disease flaring is the best strategy to minimize side effects. So for you, if you're flaring with your lupus, that's a great normal dose. But if your lupus has been under control for a long time and you have other medications on board to be decreasing your lupus symptoms, and you're like, should I lower it? Then go for it, lower it. But if you are still having flares at 15 to 20 milligrams, then for you, that's actually a low dose. Like you've got to get to whatever dose it takes to keep your body out of the flare, because we don't want the damage that lupus nephritis can cause, that all of, like, there's just so many possible complications from lupus that we want to keep you away from those. And getting to wherever your dose is, that is high or low, is good. Getting to wherever it is effective for you, I think that's important. And then doing whatever you can to minimize the side effects. Following the things in my prednisone checklist. You should download it if you haven't already. It goes through all of the things you can do to minimize your side effects. Okay, Melissa, she says, I tried 3 times to taper off prednisone. Is decreasing by 0.5 milligrams a month long enough to not have withdrawal? Currently on 5 milligrams a day. Been on prednisone for 2 years. ACTH is normal. Okay, so Melissa, I don't know what you're taking prednisone for, but you've been on 5 milligrams and you are getting stuck. You're not able to taper off prednisone. And 0.5 milligrams a month is definitely a good strategy. There's a really cool website. I'm going to try to find it, that I linked to in my How to Taper Prednisone blog. You should go there. That it gives you like all of these awesome options for how to taper prednisone for like decreasing the dose by a half milligram a month. And it tells you exactly how to do. Okay, ABPA. Okay, I'm not actually sure what that stands for. Do you want to tell me? ABPA. Um, okay, allergic bronchopulmonary aspergillosis. All right, so you've got something going on in your lungs that is not fun, and that looks horrible. I'm sorry that you've got to deal with that. Um, and if your ABPA is under control and it's really just the withdrawals that you're dealing with, because that's the thing. There's three things we're looking for when we're tapering prednisone. Is your disease under control? And I'm assuming you're checking the mark that yes, allergic bronchopulmonary aspergillosis. Yes, okay. So I'm assuming that condition is under control. If so, then you can move on to tapering. And so we're waiting to see, is it going to flare, right? Then we're looking for withdrawal symptoms. And those are feeling yucky, like you kind of have the flu, you have low energy, you can't get off the couch, fatigue. Um, some people get a fever, weight loss, just you just feel yucky. And so if that's the withdrawal you're referring to, that's the second thing to look for. And then stable symptoms on insulin. Okay, good to hear. Then finally, we're waiting for your adrenal system to recover. So withdrawal is actually different from your adrenal system. So I'm glad to hear number 3 is ACTH is normal. That means your adrenal system is on board. It's just the withdrawal symptoms. And the withdrawals are different than the adrenal system because it has to do with the glucocorticoid receptors themselves. So this has to do with your ability to make prednisone. This has to do with your ability to receive prednisone. And that there's these glucocorticoid receptors waiting for there to be enough cortisol or prednisone equivalent to stimulate them. And if they're empty, they scream and say, I'm empty, fill me. And that's the withdrawal feeling that we're feeling. Um, and so that is really hard to predict when your body is going to slowly break down each glucocorticoid receptor. And it's based on your genetics, based on your environment, and there's literally no way to predict it. And so it's just waiting. Okay, will my body let me break these glucocorticoid receptors down? And so, yeah, 0.5 milligrams a month might be enough. On that website I'm referring to, it talks about like the every other day dosing. I'm not sure if you've ever tried that, where on Monday you'd take 5 milligrams, on Tuesday you take 4 milligrams, Wednesday 5 milligrams, Thursday 4 milligrams, and you just alternate 5 4 5 4 5 4, or you do it even slower than that, 5 4 5 5 4, like every 2 days, or even just 1 day a week you go down, and it's just a really gentle taper. But yeah, 5.5 milligrams a month could be, but there's no way to know until you try it. Like every single person is different. It is an art. Tapering is an art when we're getting to this point. When you're below 5 milligrams, it is literally listening to your body and finding when it's reacting and when it's not. And it's just really hard. You have to pay attention. And then you said you have stable symptoms and you're on insulin. So that's good, that you've got that insulin on board. I'm assuming it's because of diabetes. And sometimes, theoretically, when we get lower doses of prednisone, you need lower doses of insulin. So glad you've got the insulin and hoping you're testing, making sure that your uh, blood sugars are stable and you don't get too low. But it sounds like you've been on a really slow taper and you've tried 3 times. So, all right. Um, what other questions do people have? Let me look for my list of pre-asked questions. Okay. Oh, here we go. We got the one. Hi, thank you for taking the time. I have MG for years now. I'm currently on 40 milligram one day and zero point 0.5 milligrams. Is it supposed to be 0.5 milligrams the next day? Or is that supposed to be 0.5 milligrams the next day? Or is that supposed to be 50 milligrams the next day? Or 10, can you fix that? Because I'm not sure what that says. But I'm just going to read it the way it says. Hi, thank you for taking the time. I have MG for years now. I'm currently on 40 milligram one day and 0.5 the next day. I had to take 40 milligrams every day, now tapering off slowly. Is it necessary to taper off? Yes. If you've had it for years and you've had to take it every day, you definitely need to taper off. But this is a good question for your doctor. Like some doctors will prescribe 40 milligrams every day for a week or 10 days and then not taper you. And that's a thing. Like that is a legitimate thing. But if not, 5 milligrams, you're on 40 and then 5. Okay. Thank you for clarifying. Um, yeah. uh, if you were normally on 5 milligrams and then suddenly jump up to 40, you're wondering, can you just kind of jump to 5? Is that kind of what you're asking? Because generally, once you bump up, then you need to taper off again. You can't just jump back down to 5. Once you've increased it that much, you have to slowly go off again. Maybe it's a more aggressive taper than you normally would have, like 40, 30, 20, 10, get you back down to 5. And instead of over weeks, that might be days, but it's really, you definitely got to talk to your doctor about that. But generally, if you've taken more than 10 days of prednisone in a year, you need a taper. Like you just got to taper. So definitely work with your doctor to find out. Okay. Well, I think that was our last question. This was sponsored by Nutranize, which is the supplement I invented based on my own personal experience taking prednisone and having horrible side effects. I invented it based on the side effects it causes and the nutrient depletion that prednisone is dealing us. Prednisone is stealing chromium picolinate and calcium and vitamin D and magnesium and potassium. And when we give those back, it minimizes the side effects. And so you can go get nutranize.com. Go to nutranize.com to get Nutranize Zone. It's got a bedtime bottle and a morning bottle. You take 2 morning capsules along with your prednisone dose, and then you take 2 at bedtime to help you get restful sleep and recover from taking prednisone. So this is based on my doctor of pharmacy experience and my own personal experience taking prednisone. You can also find it on Amazon. So go to nutranize.com to get the help you need today. Signing off as Dr. Megan, your prednisone pharmacist. Also, one more thing, if you are struggling with side effects and you want to know the best way to deal with those side effects, you should download my prednisone checklist. Just click the link below and you can download my prednisone checklist now, and it will tell you exactly all of the things that you need to do to counteract prednisone side effects. Oh, you're welcome, John. He said, good stuff. I'm glad it was helpful. All right. See you next week at 12 o'clock Eastern time. And we'll go live again to talk about what questions you have about prednisone and how to counteract the side effects. See you next week.